since I'm the one that's been sleeping. Good afternoon to you all. Assalamualaikum. First, I would like to thank the organizing committee for having me here, especially Dr. Rushdan. I think it's very instrumental to everybody here, so it's really nice to be. It's really nice to be among friends. Second is, I've been given this task of talking about HPV. I claim to be not an expert, okay? Definitely not an expert about male HPV patients. Definitely, I've never seen a male HPV lesion before, and certainly I've never done any colposcopy on male organs yet. Thirdly is the third statement I would like to make. I realize that some of my talk touch on certain topics which push on conflict of interest. So I would like to say to you all that I have no conflict of interest whatsoever with regards to I don't like to be too near to my face. There's some things that I don't like to be too near to my face, and the microphone is one of them. Are you alright? Can you hear me? Right. Okay. We know that I'm going to speak about a few things. The last thing, I forgot to mention. The last thing is that my talk will be short, and I will not take not much, none of the time that's necessary. Okay, I promise you that. Since late afternoon, I can see I can hear the sea calling for us. I will talk about HPV-related diseases in males, the risk factors for HPV infection males. Regards to natural infection, I think Dr. Muzami to some extent has mentioned that. And also HPV transmission to male. And eventually on HPV vaccine, again, Dr. Muzami has touched on that as well. Right. We know that apart from cervical cancer, HPV are responsible or can be responsible for a number of other lesions that may affect both male and female. For example, the anal cancers, gay and neck cancer, penile cancers, genital warts, and the recurrent respiratory papillomatosis. And it has been estimated that HPV type 16 and 18 account for approximately 90% of HPV-related anal cancers, and their association 70% of HPV-related penile cancers. HPV type 16 are approximately associated with 90% of oropharyngeal squamous cell carcinoma. HPV type 6 and 11, these are the non-oncogenic HPV, cause approximately 90% of genital warts and the recurrent respiratory papillomatosis. Right, this slide is just to show where things are, if you don't know where they are. You can see, well, I'm glad the picture is not too clear, or we got. Right, genital warts, the penile intraepithelial lesions and carcinoma, okay, the anal intraepithelial neoplasia, and some oropharyngeal cancer sorry, this slides are not very clear. Okay. With regards to the genital warts, it's very common. It's just that I don't know how common they are in Malaysia. Okay? The incidence is roughly yearly incidence is about 1 million in the US alone. So it's very, very common. The incubation period is about 3 weeks to 8 months, with the median eruptions about 2 to 3 months after primary exposure. So you can get away doing something, but something came up later after 3 months. It's quite nasty as well. 90% of these anogenital warts contain HPV 6 and 11 DNA. So quite a high percentage. Okay? And it is contagious. Okay? Affects 4% of sexually active men in the age of 18 to 59. And more than 65% of sexual partners develop these warts when exposed. The symptoms include itching, burning, tenderness at wart site, include anal, associated with anal, urethral, or vaginal bleeding or discharge. So, apart from all these things, it also cause quite a morbid psychological scarring as well. Okay. On top of that, treatment is not easy. It's painful, it's embarrassing, and also expensive. I will show a slide later regards to that. And for now, there's no such thing as once the treatment, that's it, you will have it again. Recurrence is very common. This is a slide to show cost to treat genital warts, stages of genital warts and annual cost in ringgit per case. This is I took it from my colleague from JKM, UKM, Jabatan Kewangan Syarikat UKM, Professor and Professor. The treat external genital lesions take around 3,000 to 10,000 per case per annum. Perianal anal lesion about 160,000, urethral lesion about 120 to 700 ringgit, cervical lesions take anything between 130 to 760 ringgit. I'm talking about warts, I'm not talking about cancers. Vaginal lesions for 40 up to 250 ringgit. And this is a point again that I mentioned earlier. Genital warts recurrence is common and often seen within 3 months in 35% of cases. In this case, can go up to 70%. Other form of lesion that's associated with HPV may be the head and neck cancers. Okay? We know that majority of head and neck cancers are related to tobacco usage and also alcohol usage. However, it has been reported that up to 70% of oropharyngeal cancers and 10% of laryngeal cancers are HPV related. So it's a fairly high number. And this number is actually coming up. Okay, it's quite interesting to know where we are 10 years from now. Okay, maybe HPV vaccination, maybe not 10 years, I'm talking about 20 years maybe. Yeah? So hopefully we can see other form of cancers coming down as well. Among HPV infection, among HPV positive head and neck cancers, HPV 16 is found in 90% oropharyngeal, 69% of laryngeal, and 68% of oral cavity cancers. Okay? This is the slide that I borrowed from the 2006 census, which showed in Malaysia in 2006 showed 896 cases of head and neck cancers, and comprises of 8.9%, and it comprises about 3.5 overall cancers, percent of cancer cases. Anal cancer, it is rare. It is estimated, an estimation of 99,000 new cases in 2002. I'm talking about US figure. 40% of these cases will occur in men and 60% will occur in women. It has been found that 85% of anal cancers are related to HPV. However, these incidents are more in women as compared to men. Okay? Again, I borrowed this slide in 2006 with regards to cancer registry, showed the figure as being fairly low. How about risk factors for HPV infection in males? Okay. Obviously, promiscuity is one of the most sexual partners. HIM study actually, human papillomavirus in males, HIM studies actually suggested that to be significant, you need to have at least 50 partners. So I don't know whether that's going to have any impact in Malaysia. I'm not sure about that. We don't have any data whatsoever. But to have a similar significant HPV in males who have intercourse with another male, the number come down to 3 only. So, that put homosexuals at higher risk. No circumcision is a risk factor. This is, I remember Prof. Yati from USM actually did a study, regards to HPV in male, and the urethral scraping, she said. So we all sort of cringe at the thought of urethral scraping. But the best place to take a HPV infection is on the urethral opening and the cervical ventricles, the coronal sulcus, behind the shaft, and also the scrotum and the perianal areas. So that's where you take the swabbing for HPV in male. Sex partner with CIN, we'll explore this later on. Having a new sex partner, history of sexually transmitted diseases, and also smoking. Smoking has been advocated among the cause of cervical cancer and as a student. Nowadays, nobody really touched about smoking, but I think to some extent it is true. Whether it's a primary cause affecting the immunogenicity of a person, I'm not too sure. Third is natural infection of HPV in males. This is the study that I mentioned, him studying natural history of HPV in males. The physiology or the pathophysiology of HPV in male is poorly understood. It's not well understood as it is in women. Yeah. So the study is trying to address the issue. It is a continuous prospective study evaluated at an international cohort of males aged 18 to 70 with a number of 1,159. And the objective is to define the incidence and clearance of a type-specific HPV infections. Altogether, they put down 37 HPV types among men residing in American continent, namely Brazil, Mexico, and United States, over a 4-year period. So without going into the detail of the study, what they found was, overall, the incidence of genital HPV infection is about 38.4 per 1,000 person month. Okay? And it is relatively constant across the age group, in contrast to women. Okay? HPV incidence decreases with increasing age in women. Okay? And in women, if I'm not mistaken, they have a bimodal frequency in terms of HPV infection and peak. The second is oncogenic HPV types with the highest incidence per 1,000 person months were 16, 51, 52, and 59. The non-oncogenic HPV types with the highest incidence per 1,000 person months were 6, 62, 84, and 6108. Median time to clearance of infection of any HPV type was significantly longer in men aged 13 to 30. So the younger age group has a longer time residing in disease as compared to the older age group. The older age group has a higher clearance rate. The clearance of HPV 16 in men were 2 times longer than in other oncogenic HPV types. This is also true with women as well. Okay. Clearance of an oncogenic HPV infection increased with increasing age. I mentioned that earlier. Acquisition of a new HPV infection was strongly associated with sexual behavior with female and male sexual partners. Probability of carrying an HPV infection was strongly associated with sexual behavior. So this is what has been postulated. I mean, the way that the natural history presents itself suggests that in terms of how we react to our body with regards to HPV infection is different between male and female. That compounded the issue furthermore, whether we should vaccinate our boys together with our girls. Right. HPV is readily transmitted. Okay. Everybody knows that. Okay. Influencing disease rates in both males and females. Infection is often asymptomatic or subclinical, allowing transmission to occur without knowledge of either partner. Okay. Circumcision and condom use reduce to some extent, but not altogether prevent it from happening. Transmission can still occur with unprotected areas of skin, okay, because transmission between scrotal to anal area has been proved to be significant as well in some studies. And this is another interesting point with regard to HPV transmission. More than 50% of young adults in a new sexual relationship were infected with human papillomavirus. And of these, 50% were infected with oncogenic type. So it is very significant, very high. Okay? Male HPV infection significantly contributes to infection and subsequently cervical disease in women. Okay? Based based on case control study amongst women with cervical cancer, husband's sexual behavior affects wife's risk of cervical neoplasia even when controlling for female sexual activity. Transmission through non-penetrative sexual contact was demonstrated with female NSS program. This is what I mentioned before, as well as female hand to male genitals. So probability of male to female transmission is about 40% per sexual life. Okay. This is a cumulative studies of all the statements, the cumulative statement for all the studies I mentioned before. It's just to show how contagious the disease are in regards to how difficult it is going to be to control the HPV infection. Okay. HPV test in male specific cervical cancers. We know that HPV infection causes cervical cancer. Okay. But there is a cross reaction towards male partners as well, especially if your partner has had cervical cancer, you are more likely to get HPV infection. And this slide actually showed what's happening. Okay? And the study was done in Spain, Colombia, Brazil, Thailand, and Philippines. Okay? And it showed higher incidence of HPV infection in those partners who had ICC, invasive cervical cancers, or even CIS as compared to control. How about HPV status and sexual behavior in males? Okay. Husbands of women with ICC, this is husbands of women with invasive cervical cancers or CIS have high prevalence of HPV. Increased cervical cancer risk with male sexual behavior. It has been postulated again, number of sexual partners, and some study has suggested the usage of prostitutes in the developmental of higher HPV infections. So HPV in women increases the risk of infection and common disease in male partners. This is why there is a lower clearance rate in younger age group as compared to older age group. Okay? Penile lesion and the HPV infection are frequently seen in sexual partners of women with CIN1, CIN. Okay? Regression of penile lesions is significantly slower in men whose partners are infected with the same type of HPV. And asymptomatic males whose partner have low-grade squamous intraepithelial lesion have an increased likelihood of high-risk HPV infection and abnormal penile tissues. What it means is, if partner has low-grade squamous intraepithelial lesion, chances are the man will have asymptomatic HPV infection, okay? And it may lead to abnormal penile tissue later on. Last innovation talk about is HPV vaccine in males. I'm not aware of Cervarix being used as vaccination for male, but Gardasil certainly has been approved in 10 countries up to current usage. United States, Canada, Mexico, Ecuador, Philippines, Malaysia, Macau, Australia, Hong Kong, Singapore. It's been approved by the National Pharmaceutical Control Bureau here, okay, as of September 2010, for boys and men from 9 to 26 years old in the prevention of genital warts, not for other things. Okay. This is a statement offered by FDA as of December 2010. The Gardasil was approved in prevention of anal cancers. So a little bit on the protocol 020, efficacy of quadrivalent HPV vaccine against HPV infection disease in males. In short, okay, in patients according per protocol population, that means the subjects received all 3 vaccinations and were negative for relevant HPV at enrollment. Okay. Efficacy against HPV 6, 11, 16, 18 90.4%. Efficacy against 6 and 11 slightly lower, 89.4%. In those population with intention to treat population, These are the population who received vaccine or placebo, regardless of the baseline. We don't know what was the HPV status. In protocol population, we know the HPV status prior, negative and positive. So the efficacy is something about 65.5%. Against 6, 11, 16 and 18, whereby the efficacy against 6 and 11 are 67.2. So once the infection has occurred, it's very difficult to reverse or to stop the rate. So in conclusion, the prevalence of HPV infection is high, and it's very much related to sexual activity. And the condition that it causes includes the genital warts, head and neck cancers, anal cancers, and penile cancers. The disease burden of HPV in males and in females are largely unquantified. We don't know yet how much it costs. We have calculated a lot on cervical cancers, pre-invasive diseases, but to take account of all the diseases related to HPV may be difficult. Males readily acquire and transmit HPV from their partners to their partners. It's almost like a ping-pong game. Current evidence suggests that natural history of HPV may be different from the female. So we may, the way that the clearance occurs naturally in our body is slightly different compared to male. I say we means males. Current data show that HPV infection is efficacious. Talking about Galas to prevent HPV 6, 11, 16, 18 in terms of extragenital lesions, genital warts in those HPV negative at the onset, or it is also very good illustrations that we have on HPV infection. The other thing is that there are some countries that advocate the usage of HPV vaccination for boys. Most countries that undergoing HPV vaccination as a national program will only do to girls, hoping for herd immunity. But for herd immunity to really be beneficial, you must have a higher number of coverage in terms of number of girls that being vaccinated. We don't have that yet. So, I don't know, I leave it to the audience to decide regards to whether we should or we should not vaccinate our boys. Thank you very much.